right, we've got people still joining, but we're going to go ahead and get started. Hello, and welcome to our webinar, The Use of RenoVō, an Acellular Liquid Equine Amnion Allograft in Equine Patients, sponsored by Equus Innovations and CTBS. I'm Amy Bucher. I'm going to be your host today. Please, if you haven't yet, introduce yourself in the chat and let us know where you're joining us from. As we normally do, we'll have a question and answer session at the end of today's presentation. Please use the Q&A in your Zoom options at any time during the presentation, and our presenters will answer your questions at the end of our session today. I'm very excited to introduce today's presenters, Mr. Christian Beaudry and Dr. Brent Hague. Mr. Christian Beaudry is an executive and entrepreneur with more than 21 years of biopharmaceutical and scientific research experience. Beaudry is co-founder of Equus Innovations based in Phoenix, Arizona, where he serves as Chief Operating and Scientific Officer and member of the Board of Managers. In this capacity, he is responsible for overall research and development of amniotic tissue allografts and technologies, including RenoVō. Prior to founding Equus Innovations, Mr. Beaudry served as Chief Scientific Officer at Amnion Technology, where he was instrumental in developing and bringing to market the company's human amniotic tissue product offerings. On top of these achievements, he is an inventor, co-author, and has held numerous research and operational appointments. Dr. Brent Hague received his DVM from Oklahoma State University in 1993 and was later accepted into a surgery residency at Texas A&M. He completed his training and became board certified by the American College of Veterinary Surgery in 1998. His professional interests are sports medicine, arthroscopic surgery, laser surgery, regenerative therapy, and orthopedics. He enjoys the opportunity to share his experience with fellow equine practitioners by taking part in clinical research and public speaking. Dr. Hague and his partner, Dr. Mike Major, DVM, founded their referral equine surgery practice, Oak Ridge Equine Hospital, PC, in February 2003, with the goal of providing clients with the latest technology and expertise to diagnose and treat the equine athlete. Christian and Brent, we are so excited and ready for your presentation.
Thank you, Amy, for the kind introduction, and thank you everyone for being on the webinar tonight. I know you guys are very busy, so we really appreciate you being there. So I'm going to go over the product science in more details in the next few slides, and I'm going to pass it on to Dr. Hague to go over clinical results. So let me get started with introducing the company, Equus Innovations. It was actually formed in 2017 of December. We are the developer of RenoVō, which is an acellular equine amniotic tissue allograft. We have several patents that have been developed to ways of making the product, packaging, and also method of treatments. We actually have now 6 patents on how we make RenoVō and other things. We also have partners in 2021 with CTBS for exclusive distribution of RenoVō throughout the United States. So if you want to reach out to your reps or CTBS to learn how to get it, please go ahead and do that. Our mission is to develop and provide innovative products to maximize the health and performance of horses across all breeds and athletic disciplines. So the use of amniotic tissue is nothing new. Like Amy mentioned, I was previously involved in developing human amnion products. Human amnion products have been used for over 100 years, and it has also similar history of use in equine practice. It is not unusual for veterinarians to actually use amniotic membrane patch as a wound dressing, even going back to 20, 30 years ago. So there's nothing new there. These tissues are very bioactive in nature. They contain a large amount of growth factors, cytokines. There's a short list of those proteins mentioned here, but IRAP is really high in those type of tissues, IGF, TGF, and I'm going to go over specific data on what these levels are in RenoVō in the next few slides. Just like cytokines and growth factors, amniotic tissue also has a large amount of ECM matrix proteins, mainly collagen, laminin, and the TIM molecules, which are key to help tissue remodeling and also inhibition of your MMPs, which cause defects and lesions. Proteoglycans, HA, are very abundant in amniotic tissues as well. So a lot of publications have been done on that topic. If you actually just do a quick PubMed search and type the word amniotic fluid, amniotic membrane, you're going to find over 40,000 scientific articles. This is just one example where Dr. Pierce actually published cytokines found in amniotic fluid, and then she actually looked at 400 different cytokines, and she classified them by functions. As you can see here, a large amount of proteins found in amniotic fluid are involved in inflammatory response, but also antimicrobial, immune regulations. So those are very bioactive tissues with many different functions based on those proteins. So what is RenoVō? It is a acellular liquid equine amniotic tissue allograft that is comprised of amniotic fluid and amniotic membrane in a liquid form. Tissues are recovered from healthy mares without harm to the mare or to the foal. Tissues are processed aseptically following good tissue practices here in our lab in Phoenix. And it is provided in 3 sizes, 1.5 cc, 3 cc, and 5 cc volumes. It is cryopreserved at -80 Celsius with a 2-year shelf life to ensure protein stability over time. We also have an option to keep it at -20 Celsius for up to 8 weeks. So we have built a very robust quality system mimicking the human tissue regulations, HTTPs, which includes processes, SOPs that are controlling facilities, your equipment controls, reagents, all the way to donor eligibility. So a very robust system here in Phoenix has been developed that controls every aspect of the RenoVō manufacturing process. Donor eligibility is performed on each donors. Donor consent is obtained. Normal physical exam, temperature has to be less than 102 Fahrenheit. Vaccinations have to be current, normal CBC, chemistry, and SAA, and these are natural deliveries. And we also test for infectious diseases, and they are listed here on the right of the slide. This is done on every single batches, and our quality director releases every batches manufactured based on review of all the test results and procedures. So if you look at the product content, RenoVō is comprised of those bioactive factors, cytokines, growth factors, and if you look at total proteins, we have roughly 1,600 microgram per mil of total proteins in solution in each cc of RenoVō. And because it is processed following very stringent protocols, we are able to achieve a very consistent delivery of those proteins based on different batches. So here you're looking at 6 different batches manufactured over 2 years period of time, very consistent amount of proteins between batches. If you look at the soluble cytokines and growth factors in RenoVō, the highest molecule profile is actually IRAP. So the green bar represents, goes with the scale here on the left. So it's roughly 10,000 picogram per mil of IRAP in each cc of RenoVō. TGF-beta1, MCP1, which is involved in immune regulation. Your TIM2 molecule here is critical in tissue remodeling and also inhibition of very specific molecules, the MMPs that are causing lesions. So the TIM molecules actually would inhibit that. And what is actually also nice to see here is when we did the test, the cytokines that are known to cause inflammation, like IL-1 alpha, 15, and the one listed here, actually are below limit of detection. They are not detected in the RenoVō product. So it truly has anti-inflammatory properties. Cytokines are involved in the immune regulation as well as tissue remodeling, and the one that cause inflammation are not detected. So if you look at IRAP concentration, for example, in RenoVō compared to other modalities, and here this is showing ProStride and IRAP2 and the IRAP Pro EAS. This is data coming from Arthrex Vet Systems. And what you can actually see is not only you have more IRAP in the RenoVō product, but it's also more consistent because it is manufactured, again, here in Phoenix following very stringent protocols. We are able to achieve a similar amount of proteins per cc delivered. So very consistent and also a higher concentration. So here you're looking at actually what RenoVō looks like under the microscope. So you actually have amniotic membrane particles resuspended in amniotic fluid. So you actually have growth factors and cytokines and AHA and proteoglycans and other bioactive factors that are in solution from the fluid. But you also have those proteins that are bound to this matrix here, if you zoom in on that particle. And what that does is when the product is implanted, you can actually measure, this was done in the lab in Phoenix, you can actually see a slow release of proteins over time, up to 1 month, coming from this the membrane particles. So post-implantation, not only you have soluble proteins already in solution from the fluid, but as the tissue get resorbed, you also have proteins being released over time, so you have this prolonged effect. And here you're looking at three different batches here, from a 1.5 cc and from a 3 cc vial here. So obviously more proteins in the 3 cc. So think about RenoVō has this complete next generation solution that is comprised of all of these active factors, the growth factors, the cytokines, the ECM6 proteins, the scaffolding, all that is needed to actually aid in the tissue healing. So with that being said, I'm going to pass this on to Dr. Hague, that is going to go over clinical studies that we actually have done and present some clinical cases. Brent, you're on.
Thank you, Christian. So what we wanted to do initially was get the product in use in some hands of veterinarians across the United States. So there were 14 beta test sites that actually received 10 vials of RenoVō, and then basically left it up to the discretion of the veterinarian what to treat. And then there was a client survey later, and we Dr. Duddy from Oklahoma State put together out of that set that there were over 200 cases, 100 cases that mainly dealt with desmitis. So his publication is now been through review and hopefully will be published soon. So basically, just to give you a quick summary of what Dr. Duddy is reporting in his paper, out of the 19 veterinarians that submitted 170 questionnaires, or 170 horses for 198 lesions. 100 of these horses had 128 tendinitis or desmitis lesions that met the inclusion criteria for his part of that data study. 72 horses, or 72%, with a total of 94 lesions, reported to return back to their previous level of work or exceeded their original level of work. It was interesting that 18 horses achieved that return to work at less than 3 months. 40 horses were somewhere between the 3 to 6 months, which is more common time frame for horses with desmitis that are treated with other modalities. And then 14 horses, it took greater than 6 months for them to return to use. 10% of the horses in that group did not return to previous level of work, but they were able to return at a lower level. 18%, or 20 lesions, did not return to work as a result of the injury. Overall, when all the veterinarians were questioned on the survey of whether they were satisfied with the product or not, 92% reported that they were satisfied. So the adverse events were recorded on any of the horses that were in the study. There were 13 horses that had an adverse event. Most of them were transient swelling and redness. There were 4 reports of increased lameness, all of which resolved with 72 hours after implantation with non-steroidals. And none of the horses developed a fever. Next slide, please. So a summary of results, by lesion, suspensory branch desmitis made up 30%. 66% of those horses returned to or exceeded their original level of work. Proximal suspensory desmitis, 73% returned to or exceeded their original level of work. Superficial digital flexor, 67%. Deep digital flexor tendinitis, 83% returned into or exceeded their original level of work. And then there was kind of a smattering of some other things. There were 15 collateral ligament injuries, distal sesamoidean ligament, 11, check ligament of the superficial digital flexor, And respectively, there were 90% of the collateral ligaments healed, which I thought was pretty impressive. 86% of the distal sesamoidean ligament, and then the N number of the accessory check ligament and patellar desmitis was very low, but both of those horses in both of those groups were sound. Next slide, please. So in the second study, we really wanted to look at what the effect of RenoVō on distal limb healing. This again was done at Oklahoma State. The research has been completed and it's now, publication is in preparation. Next slide, please. So basically there were 8 horses, they were normal. They had a 2.5 centimeter by 2.5 centimeter full thickness section of skin removed from the dorsal aspect of each limb at about mid cannon bone. Bandage was applied and changed every 3 days or needed until they were 9 days post-surgery. On the 9th day, one randomly selected limb received 1.5 cc's of RenoVō subcutaneous at the periphery of the wound, and the contralateral limb received 1.5 cc's of saline at the same time. Reapplied the bandage that was changed every 3 days or as needed out to 8 weeks. At each bandage change, the wounds were digitally photographed, wound margin was traced, and the wound size was recorded. And then granulation tissue formation was scored using a scale of 1 to 4. Next slide, please. So as you can see in some of the preliminary research here, as we start at day 0, of course, treatment and control size is very much the same. But as we go through here, day 7, day 14, day 21, and day 30, really day 21, you're seeing some early positive effects of the RenoVō. But as we get out to day 60, where the wounds are essentially healed, there really wasn't much difference between treatment and control. Next slide, please. So in the study, the beta study, where we basically had the product being used in clinics all around the country, there's always a question. There were several horses that had intra-articular therapy with RenoVō, which was not included in that study set that Dr. Duddy did. But the question we wanted to answer is, how inflammatory is RenoVō when it's put in the synovial structure? So resident at Steinbeck Equine, in conjunction with Dr. Schoonover at Oklahoma State, prepared a project to look at the effects of RenoVō when injected in the joint. Next slide, please. She's going to present this coming up at the Regenerative Medicine Summit. So I'll just kind of hit the highlights, and Danica will go into this a lot deeper for those of you who are going to be at the summit. But basically it was 8 adult horses. They had a complete physical exam, CBC, chemistry is normal. They hadn't had any medical treatments in the carpi for 12 weeks or anywhere else systemically 12 weeks prior to the study. No previous history of carpal joint injections. So they used the middle carpal joint and randomly assigned them to either treatment versus control on day 0. On day 0, 1, 3, 5, 10, 20, 30, 1.5 cc's of synovial fluid was aspirated for the carpal joints. Carpal joint circumference measurement, lameness exam, carpal flexion test, force plate assessment was each performed at each time point. Things that she looked at was they sent off a cytokine profile, total protein, nucleated cell count, neutrophil count, synovial fluid SAA, and then compared those results. Next slide, please. So she's going to go more into the cytokine profile. There's a lot of really interesting things that came out of this study that I thought was very positive, but for those of you who want to know all those details, please listen to her presentation. But there's no joint effusion detected in either limb at either time. There was no pattern of lameness, and that was force plate, lameness locator, and subjective lameness exam. There were no clinical signs of reactive synovitis in any joint at any time, treatment or control. And there was a significant elevation in IRAP in the treatment limbs that received RenoVō. Next slide, please. So commercially, this information comes from just basically sales data, but commercially sold, prescribed in over 6,000 horses to date. It's currently used in over 300 equine clinics. Seems to be strong product adoption among many equine practitioners. Next slide. I'll just go over a few cases, mainly to hopefully stimulate some good questions. I'll try to go through this fairly quick so we can leave time at the end for if you guys have questions of me or anything about the research that I can answer, I'll be happy to. So it's commonly used in horses with tendon and ligament injury, but there's all kinds of other things that it's been used for. And our goal is to continue to do clinical studies to try to delineate dosage, the scope of what it can be used for, and how to best benefit our equine patients with the use of RenoVō. Next slide, please. So the treatment protocol, again, is left to the discretion of the veterinarian. Typically, tendon and ligament injuries, it really depends on how long the lesion is, how much volume, but most deep flexor, superficial digital flexor, collateral ligament in the coffin joint, they're receiving 1.5 cc's administered either intralesionally if they have a core lesion or perilesional if they do not have a core. Non-healing wounds, the treatment protocol is to actually inject small volumes of RenoVō around the periphery of the lesion subcutaneously. So obviously the volume will depend on how big the wound is. Joint disease, I hardly ever use any volume higher than 1.5 cc's in a joint because there's a large amount of protein in this product. And even back when we first started to use stem cells and in the beta studies for IRAP, some of those horses would have a transient synovitis, and we all felt it was because the amount of protein we were putting in there. So most of the time I used 1.5 mils. Next slide, please. With some ultrasound images of a branch lesion. You can see baseline exam on pictures on the left, and then follow up at 6 weeks. This horse was treated with part of the product in the core lesion that you could ultrasound guide into, and the rest was put periligamentous. Next slide, please. It's a nice SDF lesion, just shows the progression baseline, follow up at 1 month, and then at 3 months. Next slide. This is a heel bulb laceration that I treated. Initially, I'd put it in a foot cast that avulsed the hoof wall. Really wasn't anything to suture. That picture on the left is after it had come out of a foot cast. I'd been in a foot cast about 3 weeks. At that time, I injected RenoVō in it, and we just went back with a bandage. And then we have pictures from the client that follow up at 7 weeks post-injection and then at 8 months. Horse was sound and went on to be a racehorse. Next slide, please. RenoVō has been injected in the base of some sarcoids, and I'll let Christian jump in here to talk a little bit about the immunomodulation that we believe is happening that is attributing to the death of these sarcoids and them healing over. But this is one over the fetlock baseline at the time of implantation. They did a second dose at 1 month, and then at 6 month follow-up, the lesion is starting to hair over. Do you want to make some comments about that, Christian?
Yes, absolutely. So this sarcoid was actually it was a 15-year-old recurring sarcoid. Dr. Larry Mettini here in Phoenix used RenoVō on that horse. Everything had been done by him before, cryotherapy, surgery, cisplatin. So everything that you can technically throw at those type of sarcoids, and it just kept coming back and coming back. So at his sole discretion, he decided to actually use RenoVō. And like you can see here, the 1 month follow-up, there was some residual left, but what he actually did is he implanted RenoVō underneath the sarcoid and a little bit around with nothing else being done to it. And then at the 1 month follow-up, he actually added a second administration and actually went away. So this is your 6 months picture here. It has been now over 2 years since that, and the sarcoid has not come back. And he actually sees that horse at least once a month. And I keep getting pictures, and there's no sign of the sarcoid coming back after being there for 15 years. So this was actually pretty nice to see. So one of the things that I profile in RenoVō, one of the cytokine, is actually MCP1, which is a cytokine involved in the immune system regulation. So, and it's also involved in attracting macrophages type 2 and also involved in modulation of inflammation. So it has multiple functions, but mainly stimulating the immune system. So, you know, potentially some of that is going on here. Obviously, we'll need to do a lot more research to better understand what's going on here, but we thought this was kind of interesting to see this literally going away and hasn't come back in 2 years. I'm going to go to the next slide, Brent.
Perfect. So we've used this product on several corneal ulcers, and I actually have used it on 2 uveitis cases that I just could not get ahead of the inflammation. The way it was used in this horse was 1 cc was injected subconjunctively, and then they used 0.25 mils through the SPL for 4 days after that. I have not used it through an SPL. I usually just do subconjunctival, and I've had good luck with that, but it's been a low number of cases. I've been happy with the ones that I have used it on. Next slide, please.
Very good. So Brent, I can just finish this.
Okay, perfect.
So thank you very much for going over all of the clinical data. We have a lot more case studies also available if you guys want to see other cases. Our field study, like Dr. Hague mentioned, is actually now pending publication. We expect publication to come out literally any moment now. The wound study, it is also coming very soon. Like Dr. Hague mentioned, all wounds had healed at 60 days, but those were normal wounds, so they were not healing wounds. So we did see an accelerated healing with the product early on at 7 days, 2 weeks and 3 weeks. But we see this working really well on healing wounds. So where you actually are delivering these bioactive factors to those injured tissues where you have chronic inflammation, and then you are delivering the IRAP-like molecules to unlock inflammation and other mediators such as TIM molecules and other interleukins, IGF, TGF, to actually go there and help in the tissue healing. So basically hitting the healing cascade at each steps with different molecules involved, and all of those have been found to be present in the product. And the case, the phase 3 study that we did in joints, like Dr. Hague mentioned, Dr. Danica Wilkowski is going to be presenting that, I believe is October 14th at the Orthobiologics Equine Summit. This is a online summit being done over 1 month, and then she's presenting the results of that study with really good outcome. Like Dr. Hague mentioned, the cytokine profile is very interesting, where we saw an increase in the high RAP in the product with no sign of lameness. And so this will be done by Dr. Wilkowski pretty soon. So what makes RenoVō unique really is not only it contains all of those bioactive factors, like I mentioned, both coming from the fluid and from the amnion, but like one of the slides that I showed, when you administer the product and has those membrane particles get resorbed, it releases factors over time too, so you have this prolonged effect as well. We have a strong, robust process of making RenoVō and also method of treatment that has been protected under our several patents. We are very strict at following good tissue practices. regulations have been implemented on the human side to actually make RenoVō all the way from tissue acquisition to releasing our products and labeling. It is very consistent between lots because it is, again, manufactured following a very robust process. So we are able to have more or less the same amount of proteins in each vial of RenoVō per cc. Proteins are stable. This is why it's being cryopreserved. When you cryopreserve products like that, proteins are remaining stable over time. So you don't see protein degradation, or they don't get denatured by processes that would denature them, such as irradiation, for example. And again, you have this sponge effect coming from the membrane particles. It's an off-the-shelf product. There's no time lapse for preparation. It's easy to order. If you guys, want something delivered tomorrow, you let me know, or you let your covetous rep know. We ship everything overnight on dry ice. You get it the next morning by 8 o'clock if you need first AM. And then you can either use it then or keep it in your regular negative 20 freezer for up to 2 months if you don't have a negative 80 freezer. So there's no blood cell components in RenoVō. So this is not a blood-based product. And also, there's no cells other from the fluid. All the cells from the fluid are removed. So this is a cell-free product. You have no white blood cells, no red blood cells. So there's no risk of having an increased amount of cytokines that could actually cause inflammation. And based on the profile that I did, actually, those cytokines are not detected in the product. And like Dr. Hague mentioned, there's a low incidence of adverse events that have been reported in all our 3 clinical studies. And this is a cost-effective product. And it's also, ready to use. So you actually, you don't have to prep, like the blood products, for example. So it's ready to use right away. So with that being said, that kind of wraps up the presentation on the product and the clinical results. And we can actually open this up now, Amy, to questions.
All right, great. So we did have our first question came through, and I want to point out I'm a marketer, not a vet. So if I mispronounce some of these words, please excuse me. I'm trying my hardest. But this question from Jillian is, any luck at resolving some of the perioliamentous fibrosis in chronic branch injuries?
Dr. Hague, that would be a question for you.
Great. I have used it in some both calf horses that have really big branches on their hind limbs. And I've also used it in some barrel horses. On ultrasound, I really don't think that there's been a lot of change. There may be some subtle decrease in size, but what I have been impressed with is the comfort level of those horses. The ones that I've used it on were definitely lame and positive deflection, and they became sound, but I can't tell you that the ultrasound, as far as the overall size and the tissue around the ligament, really changed that much. So I've done that on an N of about 3 horses. So that isn't a very big number either.
Okay. Mark asks, he says, I just diagnosed a ruptured SDFT in an older horse, very lame walking. Should I use RenoVō and when?
So I've used the RenoVō product on 2 SDFs that were completely ruptured, but both of them occurred from trauma. One was a shoeing stand and the other was one that got tangled up in a bucket. So I don't really know what your presentation is, but the skin was open on both of those. So I treated them with a bandage and antibiotics for about 3 weeks, one 3 weeks, one 4 weeks. And then I implanted it in what was left of kind of the muck of fibrin and hematoma and ligament. If it was a traumatic rupture that, the skin wasn't open and the leg just isn't really inflamed and cellulitic, then I think you could put it in at any time. If there's a lot of edema and the horse is very painful, I might be tempted to put it on non-steroidals and bandage the leg, try to quiet the leg down a little bit, and then put it in maybe a week or 7 to 10 days post rupture. I don't know if that helps, but.
Okay, great. Any cases where RenoVō would be contraindicated?
I'm sure in the face of overt infection, I'm not sure that I would put it in an infected environment. Although there's been some good studies out there of using plasma lysate and other things to treat infection in joints, because it opsonizes the bacteria and does some other things to quiet the joint down. So, but I probably would not put it in an area that I knew was overtly infected.
Have you tried RenoVō on squamous cell carcinoma lesions?
I have not.
Yeah, Dr. Hague, have not, but we actually have a case study that it was done on one horse, squamous cell carcinoma of the eye. It's actually on our website, and it actually resolved within 4 weeks, I believe, post-implantation. So I think I know of 2 or 3 cases that it was actually done.
Okay. Have you tried RenoVō on a pythium case?
Have not. I try to refer those to somebody that I don't like.
Okay. Success and approach and volume for DDFT lesions at insertion at Palmar P3.
I'm reading in the Q&A here so I can see success and approach and volume. So if it's an insertional lesion that you can't really guide a needle into that area, then the way that I've treated those enthesis injuries has been with a regional limb perfusion with a tourniquet at the fetlock, and I use 1.5 mils and QS that up to 30 mils with saline. Leave the tourniquet on 20 to 25 minutes. I've treated maybe 3 of those. Impar ligament enthesis injury was one, and then I had 2 deep digital flexor lesions. One had a lot of edema in P3 and the other one did not. But again, I don't have MRI follow-up to see how each of those healed, but their comfort level did improve considerably within about 3 days after the perfusion.
Great. Have you had much experience using it in thoroughbred racehorses, either in tendons, ligaments, or intra-articular?
Yes, one of the partners, the surgeons here in the practice, does a lot of thoroughbred racehorse sports medicine, and he's probably used it the most for tendons and ligaments. I think he has used it in some meniscal tears, intra-articular, but I don't know that he's used it as a therapeutic specifically in thoroughbred racehorses, but I do know he's used it in tendons and ligaments.
All right, this next one's not formulated as a question. Let's see, volume and periligamentous use or not for hind limb proximal suspensory ligament dysmitis. I'm not sure if that's a question or a statement.
I'm not sure either.
Okay. All right, Chad, if you want to clarify that a little bit, that would be helpful. Next one, as a general recommendation, if there is a tendon that has injury with or without a core lesion that is approximately 6 centimeters long, how much RenoVō should be used?
Uh, 6 centimeters long. I guess it depends on the diameter of the core lesion within the body of the tendon. If it's a very small core that's 6 centimeters long, that's not going to have very much volume. So what I try to estimate is based on the diameter and the length of, try to guess a volume that I think that lesion will hold without overfilling the core. And that's what I put in. And again, that's an estimated guess. I mean, you're kind of figuring that out based on the diameter and the length. And over 6 centimeters long, I probably would use, if I was going to do periligamentous, I probably would use 3 mils divided along that length. So.
Okay. Any success with using it in pod lesions in race horses?
I haven't used it for that.
Is it okay to place into a flexor tendon sheath for flexor tendonitis?
I have used it in the tendon sheath many times. Probably the most common thing is post navicular bursa arthroscopy, where you cut through the T ligament, and longitudinal tears in the deep digital flexor that we've went in and scoped the tendon sheath to clean up the fibers and stuff in the longitudinal tear. But I haven't had any issues, adverse events putting it in the tendon sheath, and I've used it quite a bit in that application.
Okay, great. Chad clarified what he was asking earlier. He says essentially wants to know the use and approach in hind limb proximal suspensory desmitis.
I haven't really had a hind limb proximal suspensory desmitis that's had a nice core. So the cases that I've treated with that has been mainly paraligamentous, and most of the time it hasn't been a very long lesion. I had one probably 2 months ago that went clear down into mid body. So I actually didn't think a 3 mil was going to be enough to go from the origin down the mid body in this horse. So I QS'd it up to about 5 mils with saline, and then I just spread it along the ligament.
Okay. And Richard would like to know, what is the chance of antibody production after repeated use?
I think that's a really good question. I've definitely used this product in horses for like a collateral ligament of the coffin joint, and then come back a year or so later and they've had something else, and we've used the product again, and I'm not seeing any reaction. I understand your concern, and I think it's a great question. I just don't really know the answer. I've not seen nor heard from other veterinarians that have used it repeatedly in the same horse there being any adverse event.
Yeah, that's a good question. Let just me add a little bit to this, Dr. Hague. Also, the product has no cells in it, so there's no viable cells. So there's really no class 2 antigens expressed on cells you may have otherwise in the product. Therefore, it's really non-immunogenic. But we don't really know, antibody productions per se, the answer to that. But because there's no cells, you're really mitigating the chance of having any antibody response.
All right, excellent. That was the last question in our Q&A and in our chat. Is there anything else? Does anyone have any last minute questions before we shut everything down? I'll give you a second here. But thank you so much, Christian and Brent, for your presentation and all your expertise today. Thank you, Equus Innovations and Covetrus, for sponsoring today's webinar. And thank you to all of our webinar participants. You guys asked great questions. That was excellent. When you exit the webinar, you're going to see a survey. Please complete every form field. Thank you so much. This ends our webinar presentation.
Thank you, Amy. And please, anybody can feel free to reach out to me at any time.
Thank you, Amy.